Jackson from Dental Vet. I just wanted to do another follow-on from our last video, going through a little bit more about infundibular restorations and what we can do to actually treat them. So I wanted to go through a little bit about how we treat them to prevent that decay from spreading to the pulps and prevent hopefully that tooth from fracturing, which can obviously end up that we need to then extract the tooth. So if we can prevent that, that's certainly much better. So just as a little bit of a quick recap, what infundibular caries are, is basically, so when we talk about the infundibulum, it's these two crescent-shaped parts in the middle of the maxillary, so the upper cheek teeth. And in a normal tooth, they should be completely filled up with cementum like this, but in some cases, unfortunately, they don't fill when the tooth is forming, and they basically have these holes in the teeth that pack with rotten food, as you can see here, and the decay can spread to the pulps and can kill the tooth, or it can basically rot to the point that unfortunately the tooth splits in half. And so I just wanted to talk a little bit today about what we can do to prevent this. So basically, once we are presented with something like this, by the time it's infected the pulp, unfortunately we have no choice, and that's why we extracted the tooth. But if we can get to it in time and we can actually treat this infundibula, then we can prevent that, hopefully prevent that from happening. So I just wanted to go through, this is a video of us cleaning out the infundibula. So I don't know if you can see here, this is just a picture on our TV screen in the clinic. We can see all of that rotten food and just packed, see how it's packed so deeply down into those infundibula there. See the really rotten, yuck food material. You can see why that then leads to demineralization and decay, and can then, I say that decay can spread. So we basically clean these out really thoroughly until we've removed all of that rotten food material. And then we actually use all human dental materials. So we use a bulk fill resin cement. But the problem is that resin cements don't bond to dental material. So we also have to, just as in human dentists, have to etch and bond. So that basically helps that restorative material to actually stick to the teeth. And so after we have cleaned it very thoroughly, disinfected the canals, etched it, so this is acid etch, which basically just slightly demineralizes the teeth, so it basically leaves the walls, instead of being really smooth like a tile, it just makes them a little bit rough, more like the sort of surface of a brick, which helps the restorative material to grip. And then the bonding material, basically as I say, the resin cement is hydrophobic, so it doesn't like water, and the teeth are wet, they have obviously water in them. And so this is basically a material that has a hydrophilic end, so an end that likes water, and a hydrophobic end that doesn't like water, and that basically is what helps the resin cement to actually bond to the tooth. And so after we have spent a long time cleaning and disinfecting, etching and bonding, we then fill the tooth. This was just an example of one where we are then basically filling that hole to prevent the food from getting back in there. This is the resin cement being placed. It sets very quickly, within probably 30 seconds or so. So yeah, basically we fill the tooth, and then this basically acts just exactly, we're basically just doing what the tooth should have done in the first place. So these should have been filled when the tooth was forming, but unfortunately in a lot of cases they don't fill properly, and we're then left with a hole. So all we're doing is basically removing all that food material and filling that hole, so there is no longer a hole for the food to pack in there and for that infection to progress. So hopefully we can prevent that tooth from fracturing or from that infection spreading to the pulps, and we can save the teeth.